am Dr. Thomas Nejipadam. I've been talking about different types of orthodontic treatments, and I've been talking about surgical treatments also these days. So, the genioplasty is one of the simplest surgeries which can actually alter your facial looks, especially for those people who have problems with your mandibular looks and things like that. So, if your mandible is small, see, then we can do an augmented genioplasty, or we can actually cut a small portion of your chin, the bone of the chin, and then slowly advance it a little more so that you have a good chin. Some people have a little bit of bird-like face wherein the chin is very small, so you can get a small, we can actually augment your chin, or you can actually increase the chin prominence so that you will get a straight face and things like that. So that is called as augmented genioplasty. So in some cases what has happened is they have a class 3 face, or they have something like a Pharaoh's face. They call it as a Pharaoh's face or a royal face, where they have a very long chin. Even that case, we can actually do a reduction genioplasty. How is it done? Now, this one is actually to augment or to increase, or we can do a decrease or using a reduction genioplasty. These are the two things. Now, it can also do in the vertical dimension also. See, if you have a very long jaw or a face is very long, and then we can actually do a reduction in the vertical segment, or reduction in the horizontal segment. That can be done. Or even we can do a, if your face is very round, then we can do a vertical thing so that you will get a little more longer face also. So all these things can be done. So it's like a plastic surgery, but so that you can give a perfect face. See, even sometimes the chin is moved to one side. That also, if your teeth are all fine, your jaw is fine, still if you have a midline correction, that also can be done with genioplasty. So now, how is it done? So now, so what they do is, there is no cut has to be done. See, that is what the most beauty of most of the jaw surgeries. You don't have to do any cut on the outside. Most of the people ask me, will I have a scar? Will you cut me on the outside? There is no need of cutting on the outside. We do all these things inside the mouth. So there is not much of a problem of having a scar outside or anything. But there will be some amount of swelling and things like that. So now, how is it done? So we open it up in the mouth itself, and we open it up under a GA. We have done this even in under local anesthetic in some cases. That was very specific, but otherwise we do it under a general anesthesia. It has to be done under a hospital system, and then we cut the bone with a, so we move it slowly as shown on the video. Here we move it, and then we put your implant screws, and then we fix it at that place. This will actually heal in another 1 month or maximum 3 months time. In 3 months time, you will have a very good facial profile with genioplasty. This is the simplest of it. Sometimes we do genioplasty in conjunction with orthodontics to give a good face and things like that. So it's a very simple procedure. It can be done in just 1 day in a hospital. You have to get admitted on the first day, and then the next day morning we can actually do the genioplasty. So it's a very simple appointment, and it's a very simple procedure. It's not a major surgery at all. So it is done by most of the orthognathic surgeons, which is available in this thing, but it needs to get admitted. That's the only point. So you might have to be put under mild antibiotics and anti-inflammatory. You can go to your office in 1 or 2 days time. This is what is all about genioplasty. If you have some issues with your jaw, if it has to be reduced and things like that, please consider genioplasty as a very good option. I'll be talking about other modes of orthognathic surgery in the videos. Please subscribe my channel. Give it to all your friends who has some problem with your face, so that they can understand more about dentistry and get their treatments done. Subscribe, like, share, whatever platforms you are seeing, whether it is YouTube, Facebook or Instagram you are watching me. Thank you very much for watching. I am Dr. Thomas Nejipadam from Nejipadam Dental at Marine Drive, Cochin, Kerala.
Wikidontist.com. Truth about tooth.